Gather the appropriate equipments.
First is to perform a hand hygiene and observe other appropriate infection prevention control. Now we can prepare the medication from an ampule or vial for drug withdrawal. And we are twisting this, removing and disposing it. Then putting the cup in the syringe. And getting enough sterile water as indicated. And avoid getting any bubbles.
Prepare the client. Introduce self and verify client's identity. Explain the procedure to the client and discuss how the result will be used. Provide with privacy. Selected and clean the site. Selected the site. Avoid using site that was or tendered, inflamed, swollen, or had a lesion. Apply clean gloves.
After we applied our clean gloves is to cleanse the skin at the site using a firm circular motion. Starting at the center and widening circle outward. And then, allow the area to dry thoroughly. We can prepare the syringe for injection. Is to remove the needle cap while waiting for antiseptic to dry. Expel any air bubbles from the syringe. Grasp the syringe with the dominant hand close to hub while holding the thumb and the forefinger, held almost parallel to the skin with the bevel of the needle up. And now, we can inject the fluid. With the non-dominant hand, pull the skin at the side until it was stuck. And then inserted the tip. Inserted the tip as far as enough to the place to the bevel through the epidermis into dermis. Stabilize the syringe and needle and injected the medication carefully and slowly so it produces a small wheal on the skin. Through the needle, quickly at the same angle that was inserted, activated, needle safety applied bandage if indicated. And then, did not massage the area. And then we can dispose the syringe and needle into a sharp. And then we can remove and dispose the gloves. And perform a hand hygiene. Fill the injection site with the ink to observe the redness or induration.
Hardening per agency policy. Put the time and date of the injection.
And then also the time.
Introduce self and verify client's identity. Explain the procedure to the client and discuss how the result will be used. Gather the appropriate equipments.
First is to perform a hand hygiene and observe other appropriate infection prevention control. Now we can prepare the medication from an ampule or vial for drug withdrawal. And we are twisting this, removing and disposing it. And putting the cup in the syringe. And getting enough sterile water as indicated. And avoid getting any bubbles.
Provided for client privacy, prepare the client. Assist the client to a position which arms, legs, or abdomen were relaxed. Obtain assistance in holding an occupied client. Selected and cleaned the site. Selected the site free of tenderness, hardening, swelling, scarring, itching, burning, or localized inflammation. Selected the site that had not been used frequently.
Applied clean gloves. Clean the site with antiseptic wipes. Started at the center site and clean and widening circle to about 5 centimeters. Allow the area to dry thoroughly and place and hold the swab between the third and the fourth finger of the non-dominant hand or position the swab in the client's skin above intended. Prepare the syringe for injection. First is to remove the needle cap while waiting for antiseptic to dry. Pull the cap straight off to avoid contaminating the needle outside to the edge of the cup and dispose the needle cup. And now is to inject the medication. Grasp the syringe with the dominant hand and hold between the thumb and the finger. Use the non-dominant hand and pinch and spread the skin site and inserted the needle. After the needle was inserted, move the non-dominant hand at the end of the plunger. Injected the medication by holding the syringe steady and depressing the plunger with a slow, even pressure. Remove the needle. Remove the needle smoothly, pulling along the line of inserted while depressing the skin with the non-dominant hand. Apply pressure to the site with a dry sterile gauze if bleeding occurs. And then, we can dispose the supplies appropriately. Activated needle safety, device or discard uncapped needle and attach the syringe into designated receptacles. And now, we can remove and discard the gloves. After that, we can perform a hand hygiene. Assess the effectiveness of medication at the time it was expected to act.
introduce self and verify client's identity, explain the procedure to the client, and discuss how the result will be used. Consulted the policy manual and determined the recommended guidelines for IM injection technique regarding aspiration.
First is to perform a hand hygiene and observe other appropriate infection prevention control. Now we can prepare the medication from an ampule or vial for drug withdrawal. And we are twisting this, removing and disposing it. And putting the cup in the syringe. And getting enough sterile water as indicated. And avoid getting any bubbles.
Provided for client privacy. Prepare the client. Assist the client to a supine position, lateral position, prone position, or sitting position, depending on the chosen site. Obtain assistance in holding an cooperative client. Selected, locate, and clean the site. Selected the site free of lesion, tenderness, swelling, hardening, or localized inflammation, and one that has not been used frequently. Use alternate sites if injection were frequent. Locate site for injection.
Apply clean gloves. Clean the site with antiseptic wipes. Use a circular motion, started at the center and move outward about 5 centimeters. And after that is to transfer and hold the swab between the third and the fourth finger of the non-dominant hand, or position the swab on the client's skin above intended. Allow the skin to dry prior injecting the medication. And after that, we can prepare the syringe for injection. First is to remove the needle cover and discard without contaminating. And after that, took caution to avoid dripping of medication on the needle prior to injection if using a prepared unit dose. Injected the medication. Injected the medication using a Z-trap technique. Use the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters to the side. Held the syringe between the thumb and the forefinger and pierced the skin smooth and quickly at a 90-degree angle and inserted the needle into the muscle. Held the barrel steadily with the non-dominant hand if consistent with agency policy. Aspirated by pulling back on the plunger with the dominant hand. Aspirated 5 to 10 seconds. Injected the medication steadily and slowly while holding the syringe approximately 5-10 seconds per milliliter. Waited 10 seconds after the injection. Withdrew the needle. Smoothly at the same angle of insertion, release the skin. Apply a gentle pressure at the site with a dry sponge. If bleeding occurred, apply pressure with a dry sterile gauze until it stopped. Activated the safety device or discard an cup needle needle and attach the syringe in a proper receptacle. And then remove and dispose the gloves. And lastly is to perform a hand hygiene. Assess the effectiveness of medication at the time it was expected to act.